Welcome medicos. Today we are going to discuss about the frequently asked questions related to the CBME course curriculum. This particular FAQ was published in NMC website only. So we will be discussing about that. So let us see what all FAQs NMC has published. The first question is, since when these guidelines will be applicable? So the guidelines will be applicable since the date of publication, that is from 1st of August 2023. And the most asked question is this one: to whom these guidelines are applicable? So these guidelines are applicable for all stakeholders, that is for every student of every batch admitted to MBBS course since 2019, presently pursuing MBBS course in a medical college or institution which is under the jurisdiction of NMC. The third question is whether a student can appear in the supplementary examination if the attendance is inadequate at the time of annual examination. The answer is no. If the attendance is less than 75% in theory and less than 80% for practical or clinical training, the student cannot appear in the supplementary examination following the regular annual examination. So attendance is must. Such student is required to take classes with junior batch commencing in the next academic year to compensate for his attendance deficit, especially the course he has missed. He will be eligible to appear in the examination in the next academic year only. So please maintain the attendance. However, before the commencement of annual examination, the college authorities may arrange for additional classes to compensate for attendance deficit. It shall be at the discretion and purview of the college authorities to arrange for making up deficiencies. So can a candidate be allowed to join the classes of the next academic year after appearing for annual examination? So let us talk about first year MBBS exam. The candidate can only join the second year MBBS exam only after the result of first MBBS are declared and he has successfully passed in all subjects in annual or supplementary examination. For second year MBBS, if a candidate fails in second prof exam, he shall be allowed to join the third prof part 1 training. However, he will not be allowed to appear in the examination unless he has passed second prof examination. For final MBBS, a candidate who fails in third prof part 1 shall be allowed to join third prof part 2 training. However, he shall not be allowed to appear in final examination or next unless he has passed final first professional examination. What is the total course duration permitted for MBBS training? Every student is required to undergo a minimum period of study extending over 4.5 academic years divided into 4 professional years from the date of commencement of the course to the date of completion of the examination, which shall be followed by 1 year of compulsory rotating medical internship. The maximum total duration of MBBS course permitted to complete the MBBS course is 10 years, including the period of compulsory rotating medical internship. Maximum permitted duration for completion of internship is 2 years. This is applicable for all MBBS students admitted in 2019 and thereafter. How are the 4 attempts or 4 years counted for first year MBBS? So, how are these attempts or year counted? No student shall be allowed more than 4 attempts for first year, that is first professional MBBS. In these 4 years, maximum number of attempts permitted shall be 4, which include supplementary examinations also. So what if the candidate fails to complete the MBBS course or mandatory internship within the stipulated time limit? So if the candidate fails to complete, qualify the course or internship in prescribed time, he shall not be allowed to continue the MBBS course under any circumstances. And how many marks have to be allotted for MCQ in the annual examination? So the maximum allotted marks for MCQ in annual examination shall be 20. It shall be at the discretion of the university to work out the details. What will be the marks required? This is very important. What will be the marks required for theory examination for passing in the annual examination if there are 2 papers for the given subject? So the aggregate or sum total of theory and practical. So this is important line. Aggregate or the sum total of theory and practical for a given subject shall be at least 50% to declare the student pass. However, the minimum score in theory and practical examination shall be at least 40% of the allotted marks. So the minimum either in theory and practical should be at least 40, but the aggregate should be 50. So for example, if the average of theory is 40%, then practical should be 60. If theory is 60, then practical should be 40. So average will be 50%. For example, if the maximum allotted marks is 100, the student shall have to score at least 40 out of 100. And when there are two papers of 100 marks each, the sum total of two papers will be 40%, which means the student have scored sum total of 80 out of 200 of both the papers. To be declared as having passed in the subject, provided he scores at least 60% in practical examination, so that the aggregate will be 50%. The vice versa is also true. As I said, if 40 in theory, then 60 in practical. If 60% in practical, then 40% in theory. So this is 50%. Will there be any grace marks in university exam? There shall be no grace marks in university examination. So there is no grace marks. How many examiners shall be required to be appointed for annual examination? Each student shall be examined by a set of 4 examiners, 2 internals and 2 external. Thus, even if a supplementary examination is to be conducted for a small number of students, 4 examiners are mandatorily required for the student's evaluation of performance. Do the external examiner have to be from outside the university, or can they be appointed even if they are from the same university? Any faculty who is not from the college where the students are to be examined shall be treated as external even if he is from the same university. However, if possible, examiners from outside the university and preferably from outside the state may be appointed as external examiners. This shall widen the horizons of students, and examiners and students across the whole country shall be evaluated more equitably. 14th, we have whether the non-medical faculty members without MBBS, MD, MS qualification can be appointed as examiners. No, only MBBS faculty with required qualification mentioned in the guidelines shall be eligible to be appointed as examiners for UG examination at all stages. That is both internal examination and final university examinations. From which batch is the family adoption program mandatory? The family adoption program through village outreach is mandatory from MBBS batch admitted in the year 23-24. Those batches who have introduced FAP, that is family adoption program, shall assess the student as per the assessment module displayed on the website. It is mandatory for all colleges to follow the guidelines mentioned in the family adoption program. We have the 16th and the last question, whether a student can take transfer or migration from one medical college to another medical college. So no, this is not allowed. No student once designated to a medical institution shall be allowed to seek transfer or migration to any other medical institution under any circumstances. Thank you.